Yeah, nobody else is in the video but us, so everything else that's streamed, you can kind of see up there what winds up, yeah. But we're very intentional and deliberate and how we at least put the information out so that everybody here feels it's conversational. Obviously, there are a couple new people, so it's feel free to interrupt at any point, and it's not interrupting, it's conversation. So we don't want you to feel like you're sitting and just listening to information, like that's where we're in our little circle, just in a space where you can constantly feel like you're a part of the conversation. I'm gonna turn the air conditioning down.
No, and like she said, the information we're gonna go over today, it is very scientific, and we're talking about anatomy, we're talking about blood flow and the bones that protect the brainstem. However, we're gonna bring it down to an element that allows you guys to be able to understand it, and then, like she said, have the opportunity to apply it. But we have some cool stories to be able to share with you on the power of the technology, the reason why Shark Tank franchised our technology out, and we're going to be able to get into some of these different inner workings here. But you want to just go ahead and just get started here?
Yeah.
Okay, so this is a very exciting story for me to share with you guys because I was part of her treatment a year ago when I was working in the headquarters office in Clearwater, Florida. So before we get into this, I'm Dr. Dan. I'm with Epic Clinics here in Pompano Beach. Shark Tank, Kevin Harrington, they were the ones that helped us get franchised out about 5 years ago. So we have offices in Seagirt, New Jersey, Melbourne, Florida, Palm Harbor is opening in 2 weeks, Clearwater is the headquarters, and then myself and Dr. Sam, who's away this weekend, we own Pompano Beach. Now, the idea behind the technology is, how many of you guys have been to a chiropractor before? 1, 2, okay, so everyone in the room. The biggest issue with my profession is there's no standard of care. You go to 7 different chiropractic offices, most likely you're gonna find 7 different things. Some wanna stretch, some want to exercise, some wanna crack, some wanna use crystals. It's just very difficult to be able to refer family members and find a congruency in the care. And the idea behind this technology is that exactly that. We're using technology. We have standards and protocols that have been peer reviewed. We're one of the only chiropractic techniques that has been published in the Orthopedic and Rheumatology Open Access Journal, as well as just a month ago we were published with Harvard Medical. So it's very exciting to see where we're going with this tech and the efficiency that it is bringing patients with the accuracy and with the technology we're going to review today. Patients don't have to keep coming in 3 times a week for 6 months on end. There's a more efficient way, and it just comes down to accuracy. So I'm going to show you a very severe and traumatic case, and then we're going to talk about more types of symptoms and disorders that are more normal to the everyday person. But for this video that's behind me that we're about to go through, her name is Rebecca Stevenson. At the time when we treated her, she was 19 years old. She was a pedestrian walking, and she was hit by a truck. She is paralyzed. She had very low brain function. They thought that she would be just like a vegetable for the rest of her life and not have that ability to have her normal quality of life and function. When they came to see us, they asked, is there anything you guys think you can do? We never promised that we're going to be able to cure or solve anything. However, when you're focusing on the bones that protect the brainstem and you focus on the ability of the body to self-heal when the body's in a proper environment, it's amazing what the body will do on its own. And so for this first case, I'm just going to have her play the video. This is prior to her very first sound wave correction to the bones that protect the brainstem. So I'll just go ahead and let this play.
So I'm just going to move over here. If you can still try and watch me. Can you open your eyes and look at me? Can you open your eyes? Okay, Rebecca, can you tell us your name? Can you tell us what your name is?
Mind you, this is about 2 months after the car accident. So this is a picture of what her alignment looked like. So when we're looking here at the horizontal line that is going across the screen, this is the line of where her atlas bone is. That is the main bone that does protect the brainstem. So when we're looking here at the skull, it rests on this very first bone, which is the atlas, right? We're going to get into a little more of the intricacies of the anatomy on why this is such a vulnerable area. But you can see here, you should be nice and relatively level. she clearly was not here. So go ahead and go to the next one, please, Yanni. So this is immediately after the first correction, 5 minutes after.
Good job. Okay. How about over here? Can you see me over here? Everybody, can you see me on this side?
She's tracking and slightly more alert, but really, within a couple minutes, we're not expecting anything crazy here. What was cool to see quickly with her case, her hands were so tightly grasped always prior to the correction. After the correction, she at least had the ability to her hands released and let go. She had no movement in her legs. 2 weeks later, her mom said she started moving her leg in the bed again, so she was starting to regain function. She's trying to make sound at least now, even 10 minutes after the video.
Good job.
Now, this was after the alignment to at least put that atlas in a more level playing field for her to be able to take the pressure off of that brainstem and allow the body's ability to start to heal and start communicating efficiently to those different structures.
And again, the alignment, it's just sound frequency. So you lie there and literally they align the machine and you hear a little noise, you know something's happening, but you don't feel, you're not manipulated at all.
We don't do any neck twisting or cracking, and that's the whole idea. There's no accuracy in that. You're a thick guy. I'm not going to convince you guys that I can feel a tiny bone in your neck with my finger to try to figure out exactly down to 100th of a degree how it's misaligned. No wonder you have to go so many times over and over again hoping for a result. Now, this video here is a year later. This was just a couple days ago.
So here's an update video on how you're doing today. So can you look at me over here?
Yeah.
Come on, piece of cake, huh? All right, what's your name? Rebecca Stevenson. How old are you? And what's your favorite thing to do? Eat food. That's fantastic. All right. Well, you sure feel a lot.
She's able to hold her own head up now. She's talking again. She's eating.
And just mention what the doctors projected for her after the accident.
They said she would never have function again. She'd constantly she'd be eating from a tube. She wouldn't have any control of her body, any of her motions. Her body was not communicating properly when that atlas bone was shoved so far out of alignment due to the accident. Now, this is obviously a very traumatic case, and this is not something that we see and deal with on a day-to-day basis, but I wanted to start with this to show the power of what happens when your body has the ability to communicate properly and also allowing that optimized blood flow to and from the brain. That's some of these other pieces we're going to get into here now.
So even just to start too, Dan, just talk about what inspired you to get into this space, because obviously we've all been to chiropractors and they're not even read in on this kind of technology. So,
I mean, I'll do the summarized version, but I had seen a chiropractor. I'm a big sports guy, so I played a lot of sports growing up. Parents took me to a chiropractor when I was 11 or 12, and I had constant headaches at that time already. I had a traumatic birth even starting, and something that really opened my eyes when I had my daughter 8 months ago is to see how not gentle they are pulling the baby out of the canal. And those structures are not yet solidified the same as we are today. So even more important to have your little ones checked as they're growing and developing. It probably would have saved my parents a ton of stress, as colicky as I was and as emotionally, I was not an easy child, to say the least. Anyways, fast forward, I joined the Army, went over to Afghanistan. I was in a recon sniper platoon for 6 years, and I think that's another part of why I really fell in love with the accuracy of this technology. But when I came back from deployment, between the trauma that happened over there, physically I was in a bad spot, mentally I was in a bad spot, and I went through the VA system. They had me on 7 different medications, uppers, downers, pain pills, sleep tranquilizers, antidepressants, a whole slew of drugs, and I was a zombie, and I was just kind of going through the motions. And finally, after 7 years of that, we were down here living in West Palm, and I was working out, and I had herniated a disc in my neck. I didn't realize that's what it was at the time. We go to the VA, and they're like, yeah, your neck seems pretty tight. I'm like, yeah, no shit. They give me a shot of Toradol and a Valium, and they're like, they did some imaging, and they're like, yeah, we'll send you a letter in the mail about a week later. I was smart enough to at least ask for the disc, took it to my local chiropractor, it was just the closest one to my house. And he's like, he popped the disc in and he's like, oh yeah, C5, C6 disc herniation, want me to fix it? I'm like, what do you mean? I just was at like a major hospital and they had no solutions. And he's like, well yeah, like this bone's here, it's limiting this here, let's just put it back. And that's one thing that has always stuck with me going through med school was your function follows your structure. When you lose structure, whether it be in an organ system or whether it be in the stability of your spine, function starts to diminish as well. Increase and improve the structure, function starts to improve very quickly. So it hurt like a you know what, he twisted and cracked my neck and he put it back in alignment. 5 days later, I was probably 90% better. And then I get the letter in the mail from the VA saying, hey, you have a C5, C6 disc herniation. It's gonna be 4 to 6 weeks for us to get you in for care. So I'm thinking, man, all my other veteran buddies, everyone else who is in my position, they're waiting minimum 6 to 7 weeks to be able to try to get some sort of relief. And I'm like, man, I'm better.
Well, they wouldn't have done what the chiropractor does.
100%.
What would they have done, probably?
Medicate.
Physical therapy, maybe maybe if I was lucky enough to get a specialty referral to a chiro, it would have taken even longer. But that was my whole aha moment was, man, there's something to this. My father and I, we tried opening a little mini business, an LLC, to help fundraise, and we did about a 3-month little pilot study. We fundraised all this money to help pay for veterans care. That model doesn't work when you have to go 3 times a week over and over and over again. The money drained very quickly. And I found that a lot of these other doctors, whether they're, I don't think it's malicious and I don't think it's immoral. I just think that's what they're taught in school and they're still teaching things from the 40s and 50s.
Yeah. And
they don't know any other better way. And they're just comfortable. It's a good business model for the doctor. Like, Connor, if I have to see you 3 times a week for a year, that's great for me. That sucks for you. And I think that was one of the things that really set this catalyst off for myself and Dr. Sam was we were both patients prior to becoming doctors. And when we set up this clinic, we really wanted to focus on the fact that let's do it as efficient as possible with as little bit of influence as possible and make it about the patient. And like, we'll profit and take care of our families by healing masses, not by draining Connor's bank account until he financially or economically burns out. And there's people that say, hey, I have the money, but they don't have the time. They don't have the time to drive 20 minutes, to be there for 20 minutes, to drive back, and it becomes a hassle in the life. Well, fast forward a little bit further, my dad, who suffered from chronic migraines for over 30 years, I'll just let you tell that story real quick. Tell them how you met Dr. Pierce, how we found this technology with the migraines you were suffering with.
At the time, I was living in Chicago, and I went to a conference, a medical conference in Nashville, and Dr. Pierce just happened to be in the room at the same conference. Didn't know I knew who he was, but I didn't know him. I had a weekend of the little dog on my shoulder telling me, go talk to him, go introduce yourself, and another one saying, don't do it, don't do it. Finally, I got the courage to introduce myself to him on Sunday morning, the last day of the conference. I told him about Dan wanting to become a chiropractor and about my issues, and he goes, I can fix you with one treatment. And I'm like, yeah, right. I told him, I've been going to doctors longer than you're old and have not had relief, and now you're going to tell me that you can do one treatment? He exposed this sound wave treatment to me. That was in September. In December, we drove down from Chicago to Clearwater. He gave me the treatment. I was able to catch my breath as soon as he set me up off the table. Headaches gone. He goes, you should be good to go now. My first correction held 2.5 years. I haven't had a headache in over 5 years. And I've been suffering 3 times a week for 40 years going to chiropractors to get that 1-day relief, 2-day relief. And I told Dr. Pierce about, Daniel wanted to be, and he goes, well, you need to get him down here. I have a training coming up. We need to show him this technology.
Yeah.
He was in the Virgin Islands at the time. And I called him up and I said, I met Dr. Pierce. He can fix me. You need to get down and meet him. He comes home early from the Virgin Islands, gets to that training, and then sees the same thing. He becomes a patient all of a sudden, gets relief, changes his whole focus as to how he's going to be in school, as to which training he's going to do, and now, he's found this training, got mentored by Dr. Pierce for these years, and now has his own clinic doing the same thing to help people.
Yeah, and I love Dr. Pierce because literally you talk to him. I met him through a mutual friend in the yoga space, and I started referring clients to him about 3 years ago. And the funny thing is like you talk to Dr. Pierce, and he's like, it was 2 years ago. You talk to him, and he's so believes in the fact that it's a one-stop thing, and that was part of his issue, even with the Shark Tank investment, was that they wanted him to have some reoccurring revenue. They were like, what can you do to keep people coming back? And he's like, no, I don't want people coming back. I want them coming for one treatment, have that treatment, walk out and feel like their entire body has changed and get rid of all the symptoms. So I wound up referring clients that could take a private plane or fly to Clearwater. I had literally 3 different clients who happened to have access to planes, and they went, and then a couple who anytime they were in the Orlando Clearwater area, they went up there, and that was, you know, over the course of the past 2 years, and just the things that they were telling me about how it completely shifted them. And then immediately, you know, before, right when your office opened here in Pompano, Stan called me up and he's like, hey, you know, we're opening there in Fort Lauderdale, let's, you know, get you guys together. And I went in and I'd thrown out my back lifting, you know, everybody knows, you know, I'm teaching yoga all the time, going to people's, I was teaching on the beach, had my crystal bowls, had all my yoga mats, went to put it down, threw out my back, and that was like 7 years ago. And I was to the point like I couldn't lift. You know, it's funny, I don't ever injure myself doing yoga or exercising. It's doing something silly, like, you know, taking something out of the dishwasher or putting down something or picking up a water bottle, you know, my Whole Foods water bottle. And so I feel it every once in a while. I feel the sensitivity. I would feel, you know, oh my gosh, am I going to throw it out again? Am I going to do something? And I did 2 more times. And then I went to you guys in April, and since then, I've never had any sensitivity, none of those little tweaks every once in a while where I feel like, oh my gosh, you know, I'm going to feel something's going to happen. And I, in talking to my clients who went and then talking to Dr. Pierce, who literally just, his whole point is he just wants to heal people. And I haven't, you know, that's obviously why I'm doing the things that I'm doing, is I just want people to feel better when they walk out the door. And he has that same drive to make sure that when you walk in, you feel that there's something that's shifted and changed, so your quality of life improves when you leave the room. And I feel like just with that intention, you know, that is what drives and propels and makes people realize, you know, this is something cutting edge. So, 100%. Yeah, so let me drop into the science. I know it's serious.
We'll figure out how it all works, right? So the first thing that I want to talk about is how does the brain communicate with the body, right? And we're just going to make this as simple as possible, but if you could leave with one thing today, your brain is what controls everything. The health of your brain is so important. And even with the way our regenerative medicine is today and with the science and technology, our physical body is set to outlive our brain health, right? So what good is your physical health if the brain inside doesn't have the ability to still take care of that physical body? I mean, even watching these Blue Zone specials that are on Netflix, there's people that are living to be 122 years old. That's insane. That's something that we're crossing into a whole new realm now. So the brain health space is it's a perfect opportunity to be able to capitalize and help people fill those gaps, right?
And not just living to 122, but thriving the entire time.
Actually
I mean,
living.
not in the space where you see, you know, 70 and 80-year-olds, you know, not being able to stand up straight and not being able to function and having chronic pain. These are people, no chronic pain, no arthritis, no inflammation, in perfect health, still muscle structure, lifting weights, and this is, I think, what we all want as we think about how we want to age, you know, and what better time to start that than early.
100%. And so the basic premise is your brain sends signals to your brainstem. From there, it goes down the spinal cord, and then out the spinal cord, you have all the spinal nerves that are controlling all the different functions, organs, limbs of the body, right? Well, what controls the muscles? The nerves. What protects the nerves? The vertebrae, the bones. So the alignment of said bones are extremely important when we're talking about nerve function and how the body operates and how we have functional control. Now, even more importantly, when we start talking about the top of the spine, where the brainstem is at. The brainstem is like the UPS center of the body. Brain sends all the messages to the brainstem, and from brainstem, everything gets organized, and it goes back to brain, it goes down to the feet, it goes through the different organs. Brainstem is what's organizing all of these functions. So that alignment of the bones that protect the brain are equally as important. Now, something that's very interesting when we're checking out this spine, You see how there is a disc above and below every one of the vertebrae throughout the entire spine, right? The discs are there to help act as shock absorbers. They help the body's ability to have stability. Also, with that being said, if you look closely here, each one of the sides of the vertebrae all the way down, they have something called facet joints. These are basically, it's like stacking chairs at a public event. You stack chairs at church or at a social event. If one of them is a little bit off cue, you give it a little shove, it slides into the track. Those facet joints are chiropractors' best friend. That's how they move bones with generalized manipulations. However, when you look up here at the top, at this atlas bone, which comes from like Greek mythology, Atlas holding the world on his shoulders. This bone here, look, there are no discs above and below it. Also, there are no facet joints, so you cannot use the same logic that you will guide this bone back into place by doing any sort of a twisting or shoving type of manipulation. Not to mention, like we talked about, Connor, earlier, this bone, it's a 3-ounce bone, the 15-pound skull on it. There's no way that I'm going to be able to feel through neck tissue, through SCM muscles, through the rest of the muscles of the neck to try to figure out how is this bone actually misaligned. Not to mention, 72% of us, we have genetic aberrancies, asymmetries. The bones aren't Legos. They do not grow perfectly 0 and 90 in stack like a Jenga tower. They have different weird little quips, and everyone's bone structure is a little bit different. So our ability with this technology to analyze and figure out down to 100th of a degree is what helps aid in that accuracy.
And then just to point out, like I just feel like, hey, it's just cool to hold. Yeah. But then if you think about even because what I learned even when we were talking about, like things that are happening up here, and I think we all see this as people age, you know, how everybody kind of starts to slunch over. We talk about this in yoga all the time, posture, alignment, standing up straight. Everybody sits up straighter when I say it. I love how that happens. Yeah. But like they literally, you start to see like people hunch over. The funny part about it, like now, is the whole text neck thing. Like everybody's looking down, everybody's, you know, on a pad or a pod or a thing, and over time, literally the whole head is dropping down. What does that do? You see everything is connected to what's happening then in the lower back. So I've worked with teenagers in yoga who can't sit up straight because they've been sitting and looking down for, you know, 5-6 years of their life, and now can't even sit up straight because it's affecting everything all the way down. You see your whole pelvis and the way it sits, the way we're sitting now, thinking about just how literally you wind up hunched over, and you see how the curvature of the spine can be entirely affected and impacted by what's happening at the top 100%. Of that stem. And even if you just feel, everybody just bring your hands, come behind your head, feel where the base of your skull is. And you got to feel in there. It should feel pretty good if you massage yourself a little bit. And then stick your thumbs in that the occipital recess. Do you see me dropping terms?
Nice.
Yes. So then talk to us as we're feeling this. Say something else about it so I don't mess it up.
So that pocket that she's talking about right there is where the skull is resting on that atlas bone here. You can see clearly the bones below the atlas, they have a completely different structure. So think about this. If you cross your arms and go ahead and just try to rotate left and rotate right, feel how limited that range of motion is compared to look with your head left and right. You have so much more range of motion and mobility at that region, but it's also why it's so vulnerable to becoming misaligned. And what we're going to talk about, and what she just alluded to, there is a lot going on in this region, not just talking about the brainstem, but we're going to get in and we're going to touch on blood flow structures to and from the brain, as well as the vagus nerve, which I'm sure if you're a part of her social wellness club, that is a hot term that you guys are familiar with. While we're on that topic, just to give a little more about what you were saying here with how this misalignment affects the entire spine, the goal of the body is to be in balance. And whether that is muscular tone of balance, whether it is balance between your parasympathetic function, our rest and digest, or our sympathetic function, our fight and flight, all the longevity studies show us we need to be in a balance between those two systems with a high autonomic activity index. All that means is your body's ability to deal and handle with stress. What is that threshold for you? How well can you fight off physical stress, mental stress, viral, bacterial? It all comes down to how well the body can be in balance to be able to adapt when a new stimulus is thrown at the body. This is what allows us to have that longevity. You can go to the next one, please. All right, so there's a lot of scientific mumbo jumbo terms here, but the main premise that I want you guys to understand here is how does the science show, why does this bone affect everything all the way down the line? So if we're looking at, here's a common thing that I see with patients that come into my office. One leg is always shorter than the other. One side of your back is always a little bit more spasmed and keyed up than the other. One shoulder might be a little bit weaker than the other, or it might click a little more, it might not have the same strength. And one side of the neck, the nerve, it's always swollen. This imbalance is a key finding. These are all neurological indicators saying that, hey, something is not right up at the top. Now, why does it show all the way down the body? One thing, when we're talking about that atlas bone, you have muscles that connect from the very first cervical vertebrae to the second cervical vertebrae. It's called the inferior obliquus capitis muscle, but it's a special muscles group because they have 242 muscle spindles per gram. What that means is your body's ability to take in data. Where am I in space? Proprioception, right? To put that in perspective, 242 muscle spindles per gram, one in the upper back or lower back only has about 30 or 40. So again, it's just bringing attention to the fact that this region of the body is taking in so much data, which is allowing the body to read and understand how to communicate.
All the important stuff is up here. That's like even like with stroke victims, with people who have had traumatic brain injury, people that have had, CTE. We talk a lot about that with the NFL players and the boxers. All of that stuff, I mean, anytime, if you're in a car accident, you have your seatbelt on, they really need to have like a head little thing, because what happens is everybody whips forward and the first thing that says, the whiplash is in the cervical spine. So there's so many things that
when you don't
there.
have the stability of the discs to help support those vertebrae at the level of brainstem, you're so much more subjected to it becoming misaligned, whether it was hitting your head on the trunk, or whether you were doing some work under the deck, or whether you got knocked in the head with a football or a volleyball. All these different things can cause this misalignment to happen. But the key thing that I want to bring into attention is, why is one leg shorter? Why is one side of my back always tighter than the other? The neurological switch that controls the balance of all the spinal musculature, it's right in the base of the brainstem. It's called the vestibular nucleus. However, when this is misaligned, it is inhibiting that switch. It is not allowing that switch to produce balance in the body. So for very generic lack of terms, if this atlas bone is rotated, right, on one side of the muscles, it might be reading only 30% of muscle tone. The other side's reading 70% stretched. So what's it gonna do? The opposite side, it'll send 70% stimulation, and then the other side only 30, trying to create balance in the spine. However, it creates an imbalance. By properly aligning this bone and turning off that switch, we allow for balance in the spine, which now again allows that pelvis to level out. Now the legs are even. Now there's no pressure on these lower body nerves for a sciatica patient, for example. So I'll go back one more time. I just want to talk about one more thing. So we're talking a lot about the muscles and the spine. I want to go back a little bit to the brain health. And that very first video that I showed you guys about Rebecca, another interesting finding for her was that was about 3 months post accident, right? Those 3 months leading up, the mom had said that her periods were not normal and she wasn't regulated, right? Well, it was very interesting to find out that 4 weeks after healing, her mom said that was one of the first things that came back was her periods normalized. And it's the same reason why we're seeing upper cervical adjustments helping with fertility and helping with people being able to become pregnant. The pathways from these exact same muscles in the neck that control the balance of our spinal musculature, they also go up to the limbic and cerebral cortex. They affect the hypothalamus and the pituitary gland, which is where all of our hormonal regulation comes from. So all of the hormones that produce levels of cortisol, how we handle stress, maybe follicle stimulating or luteinizing hormone for the ability to become fertile, to normalize those periods with progesterone and estrogen. It's all coming from a hormonal balance. So this is not just talking balance of the spine and posture and muscle aches. We're talking about overall brain health. I mean, I'm thinking of a patient right now that was 16 years old that came to see us, hit in the head with a volleyball. Very studious, very competitive. 2 weeks after her head injury with the volleyball, her parents said she was a different kid. She was no longer wanting to be active in school. She was no longer wanting to play sports. She lost the drive, and it was like, man, my little girl, she's not the same as she was. We checked her alignment. She had a counter rotation. So atlas is going one way, and that bottom vertebrae, C2 underneath it, is going another way. That's how you wring out a wash rag. So the stress that she had on the brainstem, eliminating that switch that was causing an imbalance of her hormones and the brain chemistry. After we got her corrected, it was about 3 weeks of holding her alignment and healing, because again, you don't need to keep coming back for constant sound wave adjustments. She was right back in the team. She's competitive again. She's back into school, and it's like we have our little girl back again. Personalities can change, and we see it very often. People come into the office, and they are not happy campers. They're rude, they're mean, they're in pain. I get it. However, they come back 2 weeks later, and they're chipper, they're happy, they're having more conversation, and it's like, hey, you're acting a little bit different today, and they notice it, and they feel that, hey, I don't wake up angry as much anymore. My ability to handle that stress, that threshold has increased. So I always like to talk about that it's not just so much the balance of the spine, and yeah, a lot of us, we have that constant nagging low back pain or a shoulder injury that's not healing or headaches. Yeah, but there is so much more that comes from the power of properly aligning the bones that are protecting our brainstem. It is our life source.
It explains so much about the population. We played dodgeball in elementary school. I mean, if anybody was hit with a ball in dodgeball growing up, that explains a lot about what's going on out there.
Falling off a bike, falling out of a tree.
That's
the road rage. 100%. And that's the thing. The body has an amazing ability to compensate. It's why I love the human frame. However, after so many years, I mean, if I sit like this and chat with you guys for 20 minutes, not a big deal. If I sit like this for 20 years, you think my posture is going to be the same? No way. The body only can compensate for so long until tissues start to degenerate. And, Vicki and I were chatting earlier, and I hear this so often with patients that come in. Oh, well, the doctor told me I have degenerative disc disease, and, I have a really bad arthritis in my hips, and, there's nothing you can do for me. Well, that's interesting. I would ask you to ask that doctor, is every single one of my bones have the exact same degeneration? The answer is always no. There's always a key few of them that have this degeneration. How old are the other vertebrae? How old are the other discs? They're the same age. It is not a degenerative disease that you are stuck with. Yeah. You have an imbalance of your musculature that is pinpointing one disc or two discs to fail because of that imbalance. Because when you're looking at curves in structures, if this weight of this head starts to lean forward, there's really no pressure up here on C2 and C3. However, C5 and C6, they're going to see the brunt of it, and you're going to see those vertebrae and those discs having a lot more degenerative changes. Same thing with the lumbar spine. You're supposed to have that nice lordotic curve. As soon as the body starts to go forward, you see the brunt of it happening at the bottom of the base. It's not every single vertebrae that is a degenerative disease. You have an imbalance posturally that is controlled by the balance of the brainstem that is telling everything how to act. So you have to use the logic to go to the source versus, okay, let's go get some injections. Let's do some physical therapy. You can't, if you're strengthening an imbalance, you're just going to further the problem.
And then just one thing we talk about in the Social Wellness Club all the time is that degenerative, it shouldn't even be happening. There's not, degeneration and age are not correlative. It shouldn't be happening that as you get older, things are breaking down. Yep. What breaks you down are the habits, the patterns, the environment. Correct. So if we can start changing the habits, patterns, and environment, nothing is breaking down. We're thriving, we keep and maintain, and we probably should move around in that
Let's do it.
idea. All right, up. Yes, so we always get up, do a little shake, because I don't think anybody should be sitting for more than 30 minutes at a time at any point in life. So we do a little move. And you're going to lead us through a move. Are you leading us through a move?
This is your realm.
Okay, let's move.
I'll focus here, you focus there.
We can do that. All right, so I'll ask you to ground through the big toe mounds. Phil and I just did this earlier. Hug through the big toe mounds, inner thighs hug in, shoulders draw back, and everybody reach your arms up. Take a big, deep inhale and get yourself at least a centimeter taller. So feel that you reach up, lift up, lengthen up. Now I'm going to ask you to shift the weight into your left foot. This is going to be very exciting. Put a little bend in your left knee. Take your time, and then come onto the tippy toes of your right foot. So you can stay here on the tippy toes. Just that in of itself is very fancy. And then if you want to get a little fancier, you're going to lift your right leg and hold there. Now the most important part is to smile. If you look serious while you are doing it, you are liable to fall. So you have to smile, and we're just waiting for everybody to smile until we put the right leg down. Yes. See how quickly everybody looks happy? And then start to shift. Connor, look at that. I saw that eagle wrap. Ground through the right big toe. Shift the weight into the right foot. Shoulders draw back. Lift the chin. Keep the eye gaze up, and just shift into the right foot. Come onto the toes of your left. Then when you're confident on the toes, begin to lift the left knee and just hold. And just focus, one breath and a smile. That's the work. Bring the left foot down. So you notice how much energy starts to be, you're aware of every breath. On the next exhale, do a little bend in the knees. Take one inhale and exhale. And then as it feels good, just do a little fold of the head, the shoulders. If it feels good for you to fold all the way, you can, but just let your head drop. And then ground through the big toes and then slowly come back up, one breath at a time. Use the lower belly to pull you up, shoulders draw back, take an inhale. Big smile is always very important. Bring the hands to the hips. Put a little bend in the knees, and then when it feels good, come onto the tippy toes. Beautiful. So the knees bent, grounding onto the tippy toes, shoulders draw back, don't look concerned, keep smiling. There we go. One long inhale and exhale, you got it. Lower the hips a little more, lift the heels a little higher. Lower the hips a little more, lift the heels a little higher. Take one long deep breath, lower the hips a little more, lift the heels a little higher. Try not to lean forward, lift up, one more breath. You should feel your quads like you're dancing, yes. And then come back up to standing. Let the heels drop, let the arms shake out, do a little shake and shimmy. I call it the Vegas shimmy. Vegas shimmy. Move things around. So you have a breath, I know you have a breath thing for us.
Yeah, so I think actually go to the next slide real quick. I think this is perfect time, and go one more. Perfect. Okay, so structures that are right in front of the atlas that are so important, right? Vagus nerve is one of the main ones. We already talked about the balance of getting into a parasympathetic state versus most of us are stuck in a sympathetic state, that fight and flight. So what I want you guys to do is we're going to actually sit back down here and we're just going to get into a comfortable position.
Dun, dun, dun.
We're going to go over two little quick methods that help bring us into a more parasympathetic state, right? So the first one we're going to do, it's very simple. It's called box breathing. First time I learned about this, I was in Afghanistan. We were getting ready to do a night infill, and I was scared. And it was one of our first big infills. We know we were going into a Taliban stronghold. They had 20 different fighters in there. We were coming in at 2 in the morning with night vision helicopters, and I'm just like, what the heck are we about to go into? And I see the Navy SEALs walk up that we're attached to, and they're backwards baseball hats. They're just shooting. They're just calm and cool and collected. And we pulled one of them aside and we're like, dude, how are you guys so calm right now? And he's like, well, one, we've done this 100 times, but two, when you're new, box breathing, man. On the helicopter over there, just box breathe. And I'm like, okay, that sounds too easy, but the idea behind it is when you can focus your mind only on those box breathing, what it does is it dumps acetylcholine, which is one of our neurotransmitters, onto the vagus nerve to allow the body to naturally calm down and get into a more balanced state while also hyperoxygenating the brain. So what we're going to do is we're going to take a 4-second inhale, hold for 4 seconds, exhale slowly for 4 seconds.
1, 2, 3, 4.
And breath hold for 4 seconds.
4, 3, 2, 1.
In your mind, imagine the Mission Impossible fuse.
1, 2, 3, 4.
Inhale, hold.
1, 2, 3, 4.
Exhale.
4, 3, 2, 1.
Hold.
1, 2, 3, 4.
Inhale.
4, 3, 2, 1.
Hold.
1, 2, 3, 4.
Exhale.
4, 3, 2, 1.
Now the next minute, do this on your own and just focus in your mind on that box.
As you finish up your last round, just start to notice how your body responds. Notice the tingling, the sensations. Just the awareness that the breath brings.
You'll find your mind wanting to wander somewhere else. When you focus it back to the breath and back to that box, it'll help you just focus on where you are. And you'll feel your shoulders naturally want to relax. You'll feel yourself just get into you're present. Your mind's not racing.
That's why the yogis are always so relaxed.
Now, this next one that I want to go over real quick, this is a cool way to help boost our HRV. So while we're talking about the vagus nerve, HRV is a measurement of the strength and efficiency, let's say, of that vagus nerve and how well it's communicating with other organs and regions of the body. It's called heart rate variability. But a quick way to do that, and this is the general concept, you can either do a 3-second inhale followed by a quick 5-second exhale, concept being that the exhalation is longer than the inhalation. Or if you've done breath work before, you can do a more 5-second inhalation with a 7 to 8-second exhalation. But we'll start small and let's just go ahead and do a nice 3-second inhale. And I want you guys to put your hand on your stomach and a hand on your chest. And I really want you to feel when you're taking that first initial inhalation, I don't want you to feel like your top hand rises and the chest is what's rising. That's shallow breathing. I want you to really feel like you're filling the diaphragm and the stomach first, followed by the chest. So let's do a nice 3 to 4-second inhale. Stomach, then chest, and then exhale right away. You can do your exhale through pursed lips so you can help control the time that air is exiting. Let's go ahead and do that. We're going to do about 10 breaths with this here. So you can go ahead and on your own, 3 to 5-second inhale, followed by a 5 to 7-second exhalation. Five more. How are you guys feeling? The yawns are good. It means you're activating that parasympathetic symptom. Very good.
Feel a little high, right?
Means you're doing the work. So this is also a really good breathwork strategy to use for those of you that like to do cold plunges. This is not part of my talk today. I'm just a huge proponent of cold plunges and what it does to help boost our body's immune and HRV and cold plunges. I can't say enough good things about it.
I have to correct you though. I don't ever say that I like to do cold plunges, but I say that I like the feeling after the cold plunge. Yes, the feeling after is worth every single moment while you're in it.
That's fair. And while we're on that topic, so what's very cool about the cold plunge and what it does when we're shocking the body. So not only are we activating the cold shock proteins that live in the liver, which help boost the metabolism, activates the brown fat, but also more importantly, you're getting free, clean dopamine. So when you're in a cold plunge after the fact for the next 4 to 6 hours, you have a 200% increase in dopamine. When you drop back down slowly, you fall right back to your normal threshold of where you were at. To put this into like some sort of a perspective, for those that take stimulants or drugs or whatever, and they get that initial high, their dopamine is shooting up 200%, but then they crash 200% below threshold. So cold plunge is just a nice, clean, easy way for 200% increase in free dopamine.
Yeah. The idea is we talk a lot about the sugar and talk about, how literally sugar is more addictive than cocaine, heroin, that same push that you're getting from these drugs that, people are supposedly detoxing, the sugar is the main thing.
Yep.
Yeah.
100%. So, okay, so before we move to this next topic here, this is a perfect segue to transition into blood flow, right? So the other element of the brain health and the components of the atlas bone is the importance of the blood flow structures going to and from the brain. Now, the internal carotid artery is the main artery that is bringing healthy oxygenated blood to the brain, right? Now, the internal jugular vein is the main drainage of all of our dirty deoxygenated blood. So what we're going to do real quick is we're just going to do a little activity, right? I want you guys to just put your wrist out, take your thumb, and I want you to compress those arteries that are bringing blood to the hand and the veins that are draining it away. So what's going to happen here while you're maintaining this pressure, you're going to feel the hand start to just get a little bit of a different sensation than your other hand. You're going to feel it start to filling up with a little bit of pressure. Now, the idea here is that you have arteries bringing healthy blood to the hand and veins that are draining the dirty blood away. Artery walls are much thicker than vein walls. They will get blood to the hand. Veins, however, are going to struggle to drain it. So what happens? Hand's building up with pressure. It's getting sensitive. You might be losing a little bit of the function of how your hand normally operates. You can do baby aspirin. You can do Tylenol. You can do physical therapy. I can try to crack it and adjust it. You can do all these different therapies trying to fix the hand until you move the bone or whatever is occluding those arteries. Until you restore normal blood flow to the hand, the tissues themselves are never going to have a chance to heal. This is the exact same concept of what is going on when you have an atlas bone that is rotationally misaligned because of the difference of the anatomical structure, compressing those hoses that are bringing the healthy blood to or are able to drain the dirty blood. Now, what's even more important is talking about the draining of the dirty blood out of the brain. Has anyone here ever heard of CSF fluid or cerebrospinal fluid?
No, I have no idea what it is.
So, cerebrospinal fluid is a fluid that bathes the brain, and essentially its job is to help clean the brain off of its neurotoxins, right? CSF is flowing all the way around the spinal cord and pumps all the way from the occiput down to the sacrum. However, CSF fluid drains through a little special sinus right into our internal jugular vein. If you have a rotationally misaligned atlas bone, putting pressure, can you go to the next slide, please? Putting pressure on that internal jugular vein that is trying to drain that dirty deoxygenated blood or that dirty CSF out of the brain is literally sitting in dirty bathwater. This is one of the reasons why we're seeing more today than ever because of the technology and because of the constant flexion looking down, why we have more neurodegenerative diseases. There's more MS now than ever. Parkinson's, dementia, Alzheimer's. And what's even more interesting when I want to talk about MS, 68% increased intracranial pressure. So literally they're saying one of the main causes, and it comes with increased pressure. Well, if you are compressing a hose that is supposed to be responsible for draining all that dirty fluid out of the brain, no wonder there's going to be more of a pressure differential that builds up. This also is what explains our pressure headaches and the migraines. It is a backlog of fluid pressure because this bone is compressing hoses that are responsible for bringing healthy oxygenated blood to the brain and draining the dirty out. This is so important to have this alignment to allow those structures to be optimized in our blood flow.
So next time you look down at your phone, bring the phone up and look forward. If you sit at a computer desk where you're looking down, lift up, and stand up. So just keep the focus of, where you're looking. And, we talk about like third eye, like looking at that space, just like you're looking at the tip of your nose, but just look beyond that. So you don't walk around cross-eyed. You look forward, but you're keeping your eye gaze up.
100%.
And that helps to just organize just literally how the vertebrae are sitting and stacking.
So go one more. We're going to talk one more here about the importance of the blood flow and something else that we found through data tracking between all of our different clinics. So styloid processes. I know that's a real fancy term, but we're just going to bring it simple and quick in here. Do you see this little bone? Looks like a little horn that is coming down off of the base of the skull. It's this little guy right here. This model depicts this bone as only being about 1/4 of an inch long. However, we've data tracked over 4,000 cases over the last 5 years, and 71% of the time, this bone has grown elongated down past the level of atlas. Now, what is right in front of the atlas? Vagus nerve, internal jugular vein, internal carotid artery, all these structures we just mentioned. This is not being taught in medical school. They call it Eagles syndrome, right? But what they want to do is go in and do surgery and cut those off. This is an important structure. This little bone attaches to a ligament that holds your hyoid bone in place. It's called the stylohyoid ligament. However, because of the tech and the generation of looking down constantly, iPads, phones, computers, over the last 40 years, 7 out of 10 of us in this room have elongated styloids down past the level of atlas. Watch what happens to those 2 little horns when I tilt the skull forward. Do you see how they start to move back? Well, in this model, there's plenty of room and clearance for that atlas bone to rotate. If they were an inch, 2 inches long, and if you can see the x-ray over here, those arrows that I'm highlighting in the actual lateral x-ray film, they go all the way down to the C3 vertebrae. That's this one right here that I'm pointing to. So think about that when we're looking down in flexion. No wonder there's that much more neurodegenerative diseases. The body does not have the ability to drain out the dirty deoxygenated blood. This is our brain fog. These are the starts of those, man, where did I put my keys? What was her name again?
Yeah.
It's very common. It's not normal.
Yeah.
Normal is processing, enunciation of words properly, quick recall, being able to have that forward thinking. It comes from the health of our brain and the environment that the brain is living in. All right, you can go to the next one. So, how do we fix it? What is this tech, and how are we actually able to accurately calibrate a system to put these bones back into their proper order, if you will, right? Like I told you before, we do not do any sort of neck twisting or cracking. There's no guessing. From the very first time that we've deemed a patient to be a candidate through their neurophysical, so the same way you would get a physical for your general health, we perform a neurophysical, and we determine the patient is a candidate. We put them through the customized x-rays. So normally, if you're going any other clinic, you're going to just get x-rays that are taking at a standard 10 degrees, 20 degrees. There's medical imaging guidelines that all the doctors follow. However, back to what we said earlier, our bones are not Legos. You can't just be taking generalized films in the hope that it's going to be customized to Michelle, to Vicky. It doesn't work that way. We take a baseline film at 0 degrees, and then we use spinal engineering software to analyze 23 different genetic asymmetries of how your bones have developed, as well as how they've misaligned through different traumas. And then we can actively calibrate your customized coordinates down to 100th of a degree into our sound wave adjusting machine to deliver one customized vector. So from the point that we do customized imaging to the spinal engineering software to the sound wave table, I'm never having to guess. Which this is the reason why Harvard Medical decided to do a study with us. This is why we're the only ones that are in the orthopedic and spinal journals, because we have protocols and standards that have to be followed. When you followed standard checklists, think about pilots. They have flown hundreds of times. Every single pre-flight checklist. Surgeons, they're able to decrease the amount of infections in the surgical ORs by doing what? Following checklists. When I follow standards and protocols with a already peer-reviewed technique, it gives me duplicatable outcomes. It's how we can be so confident in treating the patients that we do, because we're not having to guess. Now, this image on the left is just showing an atlas bone that is vertebrae. This lady here, she was a sciatica patient. But again, that's the crazy part about this is the brainstem controls literally everything. For some people, it might be brain fog, it might be headaches, it might be sciatica. You have to look at what the control center is sending the signals down through the rest of the spine first. Her atlas was misaligned. I think it says 1.9 over there. I'm not even going to try to say that because I actually cannot read that. However, she's misaligned in the left image. The post, she's clearly aligned. This patient is now no longer dealing with any sort of sciatica symptoms, and it happened within 2 weeks of her body being able to heal and allowing time for those tissue structures and body to start to normalize.
Yeah. I noticed after my adjustment, I had within the first week, I had a little strange something in my shoulder. I felt a little I could feel that things were, shifting in a way, I had a spasm in my one shoulder, and then, I had some strange thing in one side of my hip, and then I went in because you go, you do your one adjustment, then you go on for a couple follow-ups.
Keep a close eye for the first few weeks to ensure the procedure is becoming stable. But
yeah, and they just check your alignment and just check where you're at. But literally, I just did 2 little stretches. It did a little shift of my hips in one direction, and then literally after that 2 weeks, I've been in more aligned, no headaches, no tension in my lower back, no, idea that there'd be any sort of pain. And, obviously, I'm active, I'm doing things every day that, you know, you would think would keep you feeling, you know, in perfect health and wellness. But if things aren't perfect alignment, then, you know, how can everything else fall into place?
Something that really stuck with me too, I heard this a couple weeks ago and I love it. If people could see their spine, they would take so much better care of it.
Yeah.
If you chip a tooth, if you got nasty teeth, you go get that taken care of very quickly because you can see it. If your spine was on the front of your face and people could see it, you would take a lot better care of it.
Well, same thing with your stomach. Like, you know, if you were aware of what was going on in your belly,
100%.
then, you know, that's why it's like,
It's internal,
when we
though.
do the GI maps with Dr. Ware, like you see what's going on in your belly and how many bacteria are living their best life in there, you start to change what you're putting in there.
Yeah, no, that's huge. I love that. All right, you can go to the next one now. Thank you. So, how does, you know, I get this question a lot. Sound wave, how is a sound wave gonna move a bone? We use sound wave in the medical community already. Lithotripsy, so kidney stones busting up, it's a sound wave technology. Military uses sound wave to control riots. I'm moving the bones in your inner ear right now, small little bones with sound waves. Mm-hmm. Sound waves carry mass. And when you can directly align a sound wave at a joint structure that is not solidified and not locked in place, remember, no discs above and below, no facet joints. It's a freely movable bone. So when the patient is side lying with the help of gravity and an actual vector on your customized coordinates, a sound wave can move that bone ever so slightly. And we're talking millimeters here. We're not talking major inch shifts. We're talking, you know, it's what the weight of a dime is pressure on a nerve to cause interference. The weight of a dime. So it doesn't need to be much, but it has to be customized to your actual coordinates and your bone structure to be able to move that bone. I've been able to treat my daughter when she was 5 weeks old with this sound wave machine, as well as a 94-year-old woman with 2 cervical neck fusions. So it allows us to be able to treat the gambit without them having to have that risk of, oh, please don't twist and crack this, or let alone, if you're 94, there's no way that I'm going to be doing that anyways. So it gives us the ability to have a very non-invasive, gentle procedure while we're treating the area of a brainstem. Go to the next one. So here's just a quick little video that really covers and explains the technology of the table.
This is the Integrity Genesis adjusting instrument. It is the first 3 axes percussion solid adjusting instrument in chiropractic history. Previous models were 2 axes that actually would pivot around the patient's Z and X axes of delivery, attempting to fix an atlas misalignment that was misaligning around the Z and Y axes. Our instrument can have pure calibration. It can actually pivot on the exact way the atlas misaligns. We also have a motorized shoulder piece to assist with pre-positioning the patient's biomechanics for maximum correction. We also have laser targeting to make sure we're in the correct location. And we have digital calibration to reduce human error on top of that. The actual adjusting force is done through a percussive sound impulse. And there's an electromagnetic striking system up inside the instrument head that when that striker is released, it will hit the other end of the stationary stylus, taking the motion energy, compressing it into the stylus, traveling down, and releasing as a controlled drum beat. So we're expert drummers. We just happen to apply our drum beat on your exact coordinates from your x-rays, targeting it at the correct location, and immediately the bones shift, the nerves release, the patient can tell, and the post-x-rays look much better.
So the cool thing is they do the x-ray right before, they do the treatment, and they do the x-ray right after. So it's not like you've gone somewhere and come back. It's not like anything like major has happened other than the sound frequency, and you see the difference in what's happening with your atlas. And I, like literally, the degree changes. When you see it, I think, you know, I talk a lot in the yoga practices. I want you to see that your body changes. I want you to see that your neck gets longer, that your shoulders drop, that your legs get longer. I want you to see it immediately so that you don't believe that, you know, you have to be, you know, going through some major shift in order to see big changes. And I feel like this is one of those miraculous things. And when I talked to Dr. Pierce first, I was like, when he's explaining it to me and the enthusiasm with which he explains it, because he sees these shifts. When you're looking at your own, you know, brainstem, and you're looking at your own cranial sacral spine, and you're seeing what's happening in your body in real time, I think that's, you know, if nothing else, it's cool, but it's definitely informative.
Well, and patients, they need accountability, and the doctors need accountability to know that, hey, the procedure that I just performed, I need to know that I got the bones to move in the correct manner. There needs to be some semblance of accountability so for the patients to understand, hey, this is objective measures. This is not just some guy saying, yeah, you're good to go. No, like this is where you were prior, and this is where you are 3 minutes after the correction. So like I can show you that we've made change, as well as the neurological indicators that all change.
Yeah, then he gives you a little neck brace. You walk out the door, and he tells you, you know, don't do any yoga for 5 days, and then.
Yeah. With that being said, there is a remolding and rebalancing phase that occurs, right? So let's just go back to the musculoskeletal. If one side of the back is overstimulated and pulling on all these vertebrae, after you turn off that switch and create balance, they're gonna start moving back, right? And you're gonna notice like some aches and some pains and almost like some traveling achiness, because what's happening when you fix this position here, all of a sudden every vertebrae starts to make micro little shifts and changes back to that balance point. So if anyone in here has ever had braces, it's almost like getting braces. It doesn't feel good while they're pulling your teeth in to get straight, but it sure is a great feeling when you get those braces off and they're straight as can be, and all of a sudden you have that smile you wanted. This is a very similar type of idea.
Yeah.
Okay, so I'm just going to show you, this is a quick little testimony here. This guy had 2 back surgeries. He is a veteran in the Vietnam War, or maybe it was the Gulf War. He was a veteran in one of the wars. We asked him not to use his cane. We asked him not to hold onto the wall. This is 5 minutes after his correction. When you turn off that switch, it's instant. The body all of a sudden is not putting pressure on the disc, not putting pressure on the nerves, and giving the ability to have function back again. Now, this is an amazing case, and this was one that was really cool to see quickly. The next one I'm going to show you here really paints the picture for what it looks like after 3 months of healing. So if you can see her left eye, she cannot look left. So watch the left eye, and you can see like the whites, they both look right, they both look up. When she tries to attempt to look to the left, her left eye does not go left. Now, this is after 3 months of holding and getting the proper blood flow to these different structures. It gave the body a chance to have the ability to heal. We weren't in there doing surgery. We didn't mess with any cranial nerves. And when you're talking about eye function, we're talking about cranial nerves. Cranial nerves 2, 3, 4, 6, all relate to our eye function. What supplies those cranial nerves? Vertebral artery. Where does the vertebral artery run through? It's literally this red hose that runs directly through your atlas vertebrae. Same idea. When you have a rotationally misaligned atlas, putting pressure on a hose, blood flow going to a structure, and you're not getting the blood flow that you should be getting, things don't work. We lose function. When you fix the structure, function improves very quickly.
What does the 3 months of holding mean? Does that just mean 3 months later?
3 months later, yeah. So when I say holding, no. Yeah, no. So she wears a soft collar for 3 hours after the correction just to help stabilize. When I say holding, I mean in traditional chiropractor world, you go back 3 times a week and you're getting adjusted every time, meaning it didn't hold. It didn't stay. They made an adjustment. You feel good for a few days. It might have shifted back out due to lack of accuracy. You felt better, but then you need it again. It didn't hold. Why didn't it hold? It comes down to accuracy. When the body has the ability to hold for long periods of time, it becomes very efficient. That is where the healing comes from. And we did this the other day with the doc, and we were just chatting about healing and what does that actually look like. When you go to a typical chiropractor and you get adjusted, you're holding that adjustment for maybe a couple hours. I'll even say 1 day if they're like really good, right? Well, then you go back a week later, and then you're holding again for a day. So in that 2-week time, you were holding for 48 hours. That means your body was healing for 48 hours. In our model, when you have the accuracy down to 100th of a degree and you hold, you are now healing for every single day for those full 2 weeks. Look at the exponential amount of healing that can take place, not needing me. This is not me at your home still healing you. We facilitate the proper structure, holds with accuracy. Now when you're not in my office and you're still at home going on with your life, your body is still healing. It's been 5 or 6 months since your correction, and your body is still healing. I've seen you in my office maybe 2 times.
Yeah, twice, literally.
Literally.
Since then, yeah.
The body still has the ability to keep healing. And then, of course, when you are someone who has the right environment, you've fixed your habits, you're doing the right things, you're stretching weekly, you're getting the guidance, you're eating properly, you've mapped your GI so you know what you should or should not be eating.
Yeah.
Now the body has an environment to heal, but more importantly, all of those structures that correlate to healing they're getting the proper nervous system communication, they're getting the optimized blood flow and the oxygen that all of these structures need to be able to thrive and live. Not just live at bay, but thrive.
Yeah, and this is one of like the things I wanted to create with this community is that over time, I mean, I had an acupuncturist that I met 23 years ago, and her whole point was she did not want you having to come back into the office, and that's what made me believe in acupuncture and Eastern medicine. And then I have doctors that I speak to. I mean, Dr. Ware, one of the big things that made me want to immediately do something with him is that his whole point was, let's give you the data that you need so that you can have a lifestyle shift so that you don't have to come back and see me regularly. Yes. I find it so strange that even like when they want you to do like yearly checkups, like for your blood work, well, things shouldn't shift so much in your life. Like it shouldn't be from when you're 30 to 40 to 50 to 60 that there are these major changes that are happening, because you should be able to have something consistently happening in your life that's feeding your health and wellness. And so when I meet doctors that tell me, we want to see you as the least amount possible. Come in once, come in twice, maybe 3 times if needed, but we don't want you in and out of the office regularly, because to me that sounds immediately like a business of something where, your intention and your business thriving is not based on me feeling better and living a better life. It's based on me having to come back for whatever it is you're offering. So, I especially target and look for and make sure, that they're in my life, but that they're in this room, so that we have doctors, we have people that are working in the best interest of the people, of their patients that are coming in to see them. Because I feel like it shouldn't be a turnstile for health and wellness. It should be, a continual, upstream that we're moving, we're progressing, we're advancing, we're improving and evolving in the best way that we can. And, do that in a community, I think works out really well for all of us.
100%. No, we keep growing this movement by helping our neighbors and helping our family because you're feeling good talking about it amongst your peers, not because you're in my office 4 times a week and I'm seeing how long I can get you for.
Yeah.
That's not the angle.
And I just think just the awareness of it. It's like, we had probably 50 people at the last social wellness club when we were talking about eat, sleep, breathe, detox, because everybody, wants to detox and has an awareness of, what that is. But in trying to explain this, I know there was, a little bit of it was hard to explain. So we're working on our ability to explain it, but I hope that everybody here understands it a little more, and that, maybe you tell somebody, especially, I think we all know at least 5 people who are in pain. And, I've been doing a lot of research about the number of people that are living with either back pain, shoulder pain, hip pain, knee pain, and, between that and sleep disorders and having, the number of complaints that people have about their health and their wellness, it winds up becoming this repetitive thing when you ask somebody how they're feeling, and they have a list of issues and problems. And that was why we named it, Stop Chasing the Symptoms and Start Solving the Problems, because I don't want people to feel like it's overwhelming, it's depressing, it's anxiety driven. It's like there are all these things that happen emotionally and energetically, and I just want people to show up in the world feeling better so we can be nicer to each other. And I think it starts with being nicer to your body, because it's hard to show up in the world, happy when you're in pain. Yep. It's hard to, be in connection and community, and it's very evident, how people are interacting with each other, in the world. It's like, what can we do to, get people to treat each other a little nicer? Well, we got to be kind of, kinder to ourselves first.
Right. I want to leave you guys with one little quick story before we close up and talk and have questions, but I heard this a few weeks ago, and it really just kind of paints the picture, right? But there's a family of 3, right? A mom, a dad, and a 12-year-old girl. It's a 12-year-old girl's birthday, and the tradition in their family is there's 12 candles, so she gets 12 wishes, right? So she's wishing dad's gonna let her finally wear makeup, and she's wishing she can go to this camp, and she's wishing that she can get this new bike, and she has all these wishes, right? Now it's the dad's birthday. It's his 40th birthday. He gets 40 wishes, so he's going through their list. He's like, I want that new grill. I'm going to finally get into shape this year. I want to get this new guitar. He has all of his wishes. And now we fast forward 10 months later, and dad had a fall, and he's ridden with sciatica, and he's bedridden. And, it comes into his 41st birthday, so he gets 41 wishes, and he's sitting there, and he's just like, I have only one wish. And when you have your health, you have so many wishes. When you don't have your health, you have one wish. So it's, it's my goal, and it's, in partnership with Christine and what we're doing here, to be able to have the tools to give you guys as many wishes as you guys can as you guys keep living your life. So thank you so much for being here and participating today. And we're going to hang around to answer any questions and please.
Yeah.
The horn thing?
Yes. The styloid processes, yes.
Or whatever they were called?
The horns. Let's go with the horns. I love that.
Does this get rid of the horns?
So,
Can they get back?
so check this out. The atlas in the skull.
Last 20 minutes just thinking about
No,
About the
please, you
horns.
should
I love
have
it, though.
interrupted me. All right, so the atlas's job is to look left and look right. That is your bone that allows the skull to move left and right. So they move as a unit together, okay? However, if the atlas is improperly seated, now there's compression. So no matter which way you move, you're still compressing those joints. When we set that atlas back to your neutral position, it doesn't matter how long the horns are, because now when you're looking left and right, there is no compression. So there's no need to go in there and do surgery and cut them off. It's not like the bone or the horn has grown longer. It's that the ligament that is attached to said horn has become calcified or ossified through constant flexion, maybe whiplash trauma, whatever it may be. Them being long is not a problem. The problem is that the most movable bone in the spine, due to its different anatomy, no discs, no facet joints, it's seated improperly. There's improper biomechanics, causing pressure on these blood flow structures. And remember what we did. We only compressed one side of the hose. If you have those horns, you're compressing both sides of the hoses now. Seating it back to neutral takes pressure off those blood flow structures in the vagus nerve, allowing that no matter which way you rotate, the horns are no longer a problem. Yeah.
When a
good
doctor
question.
tells you that you need surgery to get rid of the horns, what do they say? Because I've never heard anybody talk about this particular
It's
surgery.
called Eagle syndrome. I've not met anyone who's had the surgery. I'm not sure what that conversation looks like. It's a structure that is needed. I mean, you have ligaments that are attached to it that hold this bone, your hyoid bone, in place. I'm not even sure what that looks like. I would rather not go down that road.
Yeah.
Let's just move a bone with a gentle sound wave to alleviate that even conversation.
Yeah.
Please.
Two-part question.
Yes, two-part answer.
Is everybody a candidate, and what's the ratio of success?
Yeah, so I have not examined a patient that's come into my office who has not been a candidate yet. Due to the instability of that region and the kind of lives we've lived from childhood up, I have not had someone that has not been a candidate. Dr. Pierce has been practicing much longer than me. He's told me that he's had 4 people since he's been practicing over 20 years who did not have any of those neurological indicators. Their legs were dead even, their back was equally balanced, both arms were equally as strong, and the nerve root that sits right underneath that atlas vertebrae was not swollen. He's had 4 in his entire life. So
not being a candidate
I would say
means everything's
99% of people are candidates to at least become evaluated. And we don't tell people just come down and get the procedure. We evaluate you to see and show you during the exam that your body has the ability to heal when it is properly aligned. And success rate. Are you talking for one certain condition or just general blanket?
Just general blanket for office.
The most recent stats of what I've seen, we've treated 352 people. I just actually sent these to Pierce the other day. And I have had 7 people that have not gotten the results that I would have wished them to have. When we do that math, it's like 98.2%. There are cases that have had more trauma. They've maybe had a different, like the one guy I'm thinking of, he was addicted to Vicodin and he had Gulf War syndrome. He drank like 6 shots of alcohol every night. I'm not blaming him for the non-success, but there are people, some patients that are very arthritic. So regardless of, like for example, my dad has a bone spur in his toe. I'm not going to be able to improve his alignment enough to take off a bony structure that is compressing a nerve. There are some cases that we treat and co-manage with orthopedic surgeons because they are at a point where they do need to go in there and get some laparoscopic surgery and they have to clean some things up. So this is not a magic cure. This is not one adjustment heals you for good for the rest of your life. The way we look at it is, you know what, if you needed to get 2 or 3 of these sound waves in a year versus 2 or 3 adjustments in a week, I will take that all day long.
And you guys just opened. When did you?
We opened January 19th. Yeah.
So it's like, the
We've
office
been there for
just
10 months.
opened.
Cost.
Cost, great question. So I always love asking this when I do my other health talks because it's like, if you were to go get this procedure done at a hospital without insurance, what do you think it costs?
I don't know.
Throw me a number, anyone.
25 grand.
Okay? I've heard that, I've heard $5,000. So Seagirt, New Jersey office, they charge $1,350. When Sam and I opened here, we wanted to try to have it be affordable to most. We charge $950. That includes the neurophysical, the pre and post x-rays, the sound wave, the report of findings to go over your films, the follow-up visit. That's everything. Now, you guys here today, being a part of Guided Stretch and being part of the Social Wellness Club, you guys are all going to get $100 off your neurophysical if anyone does want to come in and get information. So it would be $850. And we just started introducing a month ago 0% interest financing. I have people that say, Doc, I can't pay that, but I can give you $150 today, and then I'll pay $100 a month for 7 months. And I say, cool, man. If that's what it takes to get you the care you need and go out and talk about it, we're not here to nickel and dime and make money on it.
Do you take insurance?
So,
Insurance take you? Or-
yes. Okay, so we don't work hand in hand with insurance companies. However, we give every patient a super bill that has all of the actual chiropractic codes on it. If you pay for an insurance plan that covers chiropractic, yeah, then if they cover it, supplemental, then you will get reimbursed. We just don't work with the insurance companies, but they are reimbursable services.
Yeah.
And does it, so that would fall under the flex,
I've had people use HSA. I've had people, when it gets to those kind of questions, I say call my office manager. They'll tell you what you need to know. They'll give you all the codes you need. You can then call up your insurance company and say, hey, do you cover XYZ? They're standard chiropractic codes. 98940 is a one region adjustment. That is any chiropractic office that you go to. I'm still adjusting one region. The fact that we use a fancy sound wave to do it is just benefit for the patient, but insurance isn't taking any pieces of that.
So is the evaluation and the actual sound wave thing on the same day?
It can be. I have patients who fly in and they just want to get it knocked out and done. I have patients who are trying to fit it in at the end of the day. They'll do an evaluation with me on Tuesday night, and then they'll come back on Thursday and get their x-rays and get their procedure. Most of the time, I would say about 80% of the time, we just book a 2-hour window. You come in, you get evaluated, we determine that you are in fact a candidate, and then we go right through the x-rays right then. You wait for 20 minutes while the engineering software and myself analyzes it. We review your case with you so you understand exactly what is going on and show you how it's correlating to your symptoms. We do the sound wave procedure, and right there immediately on the table, so for example, if we, we can even do this if someone wants, but if we evaluated someone right now, one leg would be shorter than the other, one back would be more spasm, one arm would be a little bit weaker.
We can use Vicky. She's happy to volunteer.
Okay. As soon as we're done with the sound wave procedure,
Just that I know she's open. I asked her just now, but I know she's open to that kind of thing.
as soon as
Vicky
we
and I have
do
known
the
each other
sound
a
wave
long time.
procedure, the legs are dead even, the
Yeah,
back is
yeah.
balanced, and the nerve is clear literally instantly.
Have
And we
them
go
just
over
check
all
out
that,
in
and then
the
we do the post x-rays all same day.
We got you.
What are your hours though?
We got you.
What's your last appointment on the weekday, for example?
Our hours are 9 to 6. I have a lady that's flying in next week, and she has to do it at 7 p.m., and I'm staying late. We work with every patient individually. I work Saturdays, I work Sundays. We are here for you.
And his only thing is that when you go in and you get adjusted, try to leave your evening free so that you can just relax.
You won't be working out after. You're going to be
Yeah.
on light duty for a couple days. You still can go to your job the next day. You still can work. I don't want you deadlifting, putting a squat bar, no running. Yeah, a soft cervical collar.
For 3 hours. 3 hours.
3 days. Or sorry, 3 hours. I'm sorry.
Yeah.
You're tricking me up.
No,
It's
3
just 3
hours.
hours. If you get it done at 5 p.m., you wear it from 5 to 8, you take it off before you go to bed. Some of my patients say they like to sleep in it because it turns off their neck muscles, and that's the whole idea.
Yeah.
I want you limiting the amount of stimulus that is coming into that region while it learns that new neutral position.
I had made the mistake. I had an event that I was speaking at that evening, and he was like, "What are you doing?" I said, "But I had to drive down to Miami, which meant I was driving. So I purposely am not turning to look, cars when I'm changing lanes. Then I'm sitting and I'm trying to be social. So I'm sure people thought I was a little nuts because I didn't. It was 3 hours, 4 hours after I took the brace off, but I still, I didn't want to turn my head because it's a funny thing when it happens is you get hyper aware of when you turn your head after you've had your atlas adjusted. So I'm at this networking event in Miami, and I'm like sitting there, and I literally, every time I turn, I just did this whole thing.
Good.
Like, I just did not want to turn my head, and people are looking at me a little funny, but I was like,
And we say this to be extra cautious. I have a Corn Ferry golfer that plays on tour that he had like a round later that afternoon. He was corrected and he played golf that day, which is like not a recommendation. However, we have the data. So even if he were to go out of alignment and he had to go back in, it's not $950 again. We're not doing all brand new x-rays, doing the full thing. It's a basic $100 office visit. We put it back in. I've had a guy that we got corrected a week later, car accident, a little fender bender.
He gets the ultrasound treatment, or
The sound wave, yep.
the sound wave treatment again.
Yep, but my point was he didn't need it. So like, I like people to be extra cautious just to help the longevity of holding, just to save your pocket. However, I have people that are like, dude, I have to go to work. I have to go do this. And it's like, hey, I get it. Go live your life. And that's what I want you getting back to.
yeah.
So,
All right, let's
Awesome.
move around.
Yes,
We're
please.
here talking, so we're in a social space. So feel free to talk to Dr. Dan. Vicky, you want to go on the table so we can use
Yeah.
Vicky as a test?